Hi, good morning Marlo. My name is Vince Richmonds. I'm your invigilator for the OET speaking session on the 22nd of March 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Marlo Clark.
And what is your candidate number, please?
My candidate number is 217251883.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Give me a short brief about yourself on the basis of your career.
I find myself a very active person and a good communicator. I've been working in this nursing field for the past 2 years, and this has helped me to build my confidence and taught me the meaning of good patient care. In my last role, I juggled on different patient keeps, assisted in a charity fundraiser, and also was an advocate for senior patients. Working in different domains made me much stronger and confident to move ahead.
What do you find most pleasing about being a nurse?
According to me, the recovery of a patient, from his condition when admitted to the hospital, is something priceless. Seeing patients and their dear ones' happiness, and relief from the bad time they had, will fill my mind with satisfaction. What I find most pleasing about nursing is something like seeing a person standing at his or her own feet, after getting recovered from major surgery, or helping patients and their families with the most important issues, which is absolutely rewarding for me.
What do you think of your earlier boss?
My previous boss, at the hospital where I worked, trained me on the importance of work and time management. And obviously, this is my priority, being a nurse as well. He was extraordinarily aim-driven, and wouldn't make excuses if the job was not correctly done on time. Being a healthcare worker, time management and work completion is of utmost importance. I am proud and thankful for him, being my boss and teaching this precious formula. It helped me to become a successful nurse.
Name some skills that are mandatory for a nurse in order to be successful in his or her career.
Apart from technical skills and theoretical knowledge, a nurse needs some special soft skills, which are teamwork, communication, listening and understanding skills, empathy, organizational skills, patience and hard work, etc.
Would you become a doctor?
I am proud to be a nurse. I understand the importance of a nurse in a healthcare setting. Hence, I am very much happy to be a nurse. On the other hand, I wish to enhance my career, and also to stay updated. After having enough work experience, I would like to do my master's in nursing, and elevate my career to the next level. After retirement, I wish to dedicate my experience to the young aspirants, by becoming a teacher, and a guide, to making them build their careers successfully. Hence, I don't wish to become a doctor.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning, Vince. I am your attending nurse in the ward, Marlo Clark, here. How are you today?
I am all good, nurse. Thank you for asking.
I am so happy to see you recovering well during your stay here in the hospital ward. Now, the doctor has given you the discharge. I am here to discuss the discharge information and post-discharge care.
That's great.
Well, Vince, I would like to know how you feel about your present health condition.
I feel much better, nurse. However, the cough still persists, which is quite bothersome. And I think the inhaler has to make it part of my living.
I really understand your words, Vince. Try not to worry too much. You have recovered so better. And this is a positive sign. I reassure you that, if you take care of your health, you can become even far better and lead a normal life as before.
Sure, nurse. Definitely, I will take care of my health.
Good to hear that, Vince. Medication is very important. Make sure you take them on time, without any failure.
Okay, nurse.
For your understanding, medicine name, time, and dosage are clearly mentioned over each of the packets. Now you will find it much easier to take. Isn't it, Vince?
Yes, nurse. Thank you very much for sorting it.
With pleasure, Vince.
Nurse, is there anything that I should take care of during my recovery time at home?
Yes, of course. I will explain them to you.
Okay.
The foremost importance is the quality of the air you breathe. Avoid smoking, and avoid second-hand smoke as well. Avoid other respiratory irritants. These include fumes from paint and automobile exhaust, some cooking odors, certain perfumes, even burning candles and incense. Change furnace and air conditioner filters regularly to limit pollutants.
Oh, I see.
Another important factor is to protect yourself from cold air. Cold air can cause spasms of the bronchial passages, making it even more difficult to breathe. During cold weather, wear a soft scarf or a cold air mask, which will be available from a pharmacy, over your mouth and nose, before going outside, to warm the air entering your lungs.
I will take care of it, nurse.
Then I strongly recommend you to use a face mask whenever it is necessary, and avoid taking risks.
Your recommendation will be really helpful, and I will definitely follow it.
I am so happy to hear that. Next is to do exercise regularly. Try not to let your breathing problems keep you from getting regular exercise, which can significantly increase your lung capacity. I can provide a detailed brochure regarding the type of exercises you can practice.
Thank you, nurse.
Also, breathing exercises and techniques may help to reduce your breathlessness and improve your ability to exercise. So continue to do some breathing exercises, as of now.
All right, I will focus on it.
I appreciate your positive attitude. Being optimistic will make you feel more energetic and rejuvenated.
Thank you for your words.
Finally and importantly, you should also receive proper nutrition. In the early stages of emphysema, many people need to lose weight, while people with late-stage emphysema often need to gain weight.
Well, could you please explain the diet to be followed, nurse?
Don't worry, Vince. I will provide a booklet which contains details about the diet for you.
That would be enough, nurse. I can refer to it.
Vince, if you feel any difficulty, contact the hospital immediately and seek help. Also, consult the doctor periodically for better health.
Okay, nurse, I will do it accordingly.
Vince, I hope I have cleared all your concerns. I wish you a better healthy life ahead.
Thank you, nurse. That is the end of your OET speaking roleplay. All the best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.